life-changing details.
Then cuts out the degenerated disc and replaces it with an artificial spacer called an interbody that is packed with cadaver bone. The spacer is...
Chances are you'll forget 70% of what the doctor said, or the whole thing, capturing all the important. You can trust the medical memory for life's most important, all the important details.
You cannot undergo surgery unless you acknowledge that you have listened and understood.
This has happened before, so please make sure you challenge my recommendations.
Sure to follow through and to just start to deal with what was really happening.
Longer operative times, previous wound infection, diabetes, chronic steroid use, obesity, and smoking. If a clot breaks surgery expectations. You should expect a pre-op visit with your primary care or hospitalist during the week before surgery. At that time, you will undergo testing such as blood work, EKG, and a chest x-ray to make sure you are...
Not a soft herniated disc. This is disc osteophyte complex. Artery this way. Pull your trachea and your esophagus this way.
Bodies, an area called the end plates, come into contact with each other, resulting...
Quadriplegic, chance of that. It sounds scary, but chance of that.
And physicians is critical to care, but the average person remembers...
to help stabilize the spine during movement and aiding in flexibility of the back.
Understand what I'm telling them. They seem like they understand, and they come back to me a month later and say, I don't remember a word that you told me.
If you start today, walk 15 minutes today, tomorrow, and the next day, and if you're feeling well, add 5 minutes every day thereafter. We still do not...
This has happened before, so please make sure you challenge my recommendations. This procedure has some unique complications with it, but also has many advantages. The main advantage is
the discharge feature works exactly like clinical. It just allows
as a shock absorber to help stabilize the spine during movement and aiding in flexibility of the back.
And then you're going to choose your provider. The provider you'll choose is your name or
deal with the diagnosis of cancer to begin with. It's exhausting. The whole decision-making process was much larger.
That's where, kind of to optimize this tool for your guys' space, anyone doesn't have any questions just about the why and how this kind of came to be.
So it kind of goes through it in there. So it also says that video has been sent, who's been sent videos, and if they've watched them or not. So you can see, okay, these videos
patients are overwhelmed. It's a lot of information. There's a lot of
a shock absorber to help stabilize the spine during movement and aiding in flexibility of the back.
Patient engagement. So we're just going to kind of walk through how this came to be, how this came to be.
The good news is we only have about 1,400 miles left to go. Right at about 2 hours.
Home, or you can send a password-protected link to anyone, anywhere. You can share your video with loved ones